Hello everyone, this is James Matthew Bessa, a second-year nursing student in Selkirk College. And welcome to my health teaching session. Today we're going to talk about healthy sexuality and post-reproductive cancer. Let's get started. First of all, I'm going to lay out my agenda for today. So in minutes 1 and 2, I will do my introduction, which involves the learning contract, limitation of the material. In minutes 2 to 7, I will discuss or show you a video presentation that I made entitled How Important is Sexual Health? In minutes 7 to 12, I will discuss, or we're going to have a discussion about post-cancer patients' sexual health issues and treatments. And in minutes 12 to 14, you guys are going to do an evaluation at your own pace and your own time. This would involve the presentation evaluation and content or learning evaluation. Now let's go to the learning contract. Sexual health, sex, and cancer are a sensitive topic for some people. Therefore, you guys will not be expected to stay in the session if and only if the topic is too sensitive for you to participate in. Those participants who would feel emotionally disturbed or in any way feel uneasy or unsafe with the topic can and should talk to our instructor to do a debrief. Okay? Next, the limitation of the material. The material is only limited to the information about the definition of sexual health, sex as a noun and a verb, post-reproductive cancer effects and treatments, and managing the effects of cancer therapies. Due to the limited 15-minute time frame, I will not discuss information about the complexity of gender orientations in relation to post-reproductive cancer experience and sexual health, such as the cases specific to our fellow LGBTQIA+ patients. Now, before I play the video that I prepared for you guys, I want you to think about this fact. 46% of all reported cancer cases are reproductive system related, whereas 71% of these patients do not receive any care for sexual health dysfunctions. But the big question is, why is this happening? This is because patients often do not spontaneously note problems with their sexual life and prefer healthcare providers to actually initiate the discussion because of embarrassment, fear, or other reasons. However, healthcare providers also often ill-equipped to deal with sexual health issues, are embarrassed themselves, and often lack resources to offer to patients and their partners if they do identify a problem. Now, to better understand sexual health and its importance, I want you guys to watch this video that was made by a student, which is me, in collaboration with other students and for the students just like you and the general public. This is entitled, How Important is Sexual Health? Enjoy.
Hey Cortana, play some music.
Sure, I could shuffle all day.
Today, we're going to talk about sexual health.
That's it.
Okay,
Okay. I don't quite did it.
I'm sorry, just move.
sexual health is one of the very uncommon things that's being discussed in our present-day society due to its sensitive nature. It is so uncommon, though, that sometimes it's mistakenly considered to be unimportant. But is it really unimportant? What is sexual health, and why does it matter?
Sexual health for me is your holistic well-being related to your sexuality.
Involves physical, mental, and emotional well-being.
So reproductive health, sexual education, and get access to the information and products that you need.
Basic requirement of the body when you need to let go your semen.
Reproduction.
That's correct.
According to the World Health Organization, sexual health is the state of physical, mental, emotional, and social well-being in relation to sexuality. Whereas sexuality was defined as a central aspect of being human throughout life, encompasses sex, gender identities and roles, sexual orientation, eroticism, pleasure, intimacy, and reproduction. On the other hand, sex as a verb can be
Physical touch, kiss, and all like that.
I think just going on a date and stuff.
Kissing some people or hug some people.
Be with whenever you like to be, know what you want, start at the moment that you want to start.
Touch, kiss, and share time with the other person.
Penetration, of course, is part of it, but the simple ways of kissing, touching, doing oral sex, that's still considered sex.
Sweet talks, kissing, that will lead to
actual penetration, like a man penis inserting to the woman vagina.
I think it really depends on person to person what your definition is. I think there's necessarily one definition that fits on.
But what is the issue here? In 2016, a research published in the Journal of Sexual Medicine said that only 62.2% of men and 42.8% of women consider sexual health as highly important, and the rest of them said it's not. Sexual health indeed is a very sensitive topic, but that doesn't make it unimportant. We all know now that it involves your physical, mental, emotional, and social well-being, and that's a very big part of your life. So we need to advocate for ourselves. We need to tell our practitioners, nurses, doctors, therapists, and everyone else included in our health to make sure that we are healthy sexually. Always remember that a good sexual life is a healthy life. Be healthy, people.
Beautiful people, top designer clothes, front row fashion shows. What you do and who you know inside the world of beautiful people. Champagne and rolled up nose, prenups and broken homes. Surrounded but still alone. Let's leave the party. That's not who we are. We are not beautiful.
We're done there. Okay, the next thing we're gonna do is, this is totally optional. I want you guys to close your eyes and think about the sexiest part of your body and your most attractive talent, characteristics, and trait. Now, think about our cancer patients. What do you think are they feeling? What do you think are the thoughts in their mind after cancer? Let me help you there. There are many types of cancer treatments available in our market today. This could involve radiation, chemotherapy, surgery, biological therapy, gene therapy, hormonal therapy, and many more. But today we're just going to focus on the side effects and adverse effects of radiation, chemotherapy, and surgery. The first side effect of cancer treatment, specifically radiation, are infertility issues. Basically, the higher amount of radiation the cancer patient received is the higher chances that he or she will experience infertility due to aspermia or cessation of menses. In males, if the cancer patient received 300 to 600 centigrade of radiation in his treatment, there is a 50-50 chance that the patient can recover or not in 2 to 5 years. In females, the older the patient is, the higher chances of having infertility issues she will get. According to our table for female cancer patients receiving radiation that can be seen in the middle of the screen, 40 years old is the cutoff of age, whereas females who are 40 years old and younger have 95% chance of experiencing permanent cessation of menses if they received 500 to 1000 centigrade of radiation, and 95% and above for patients who are 40 years old and older who received 375 centigrade of radiation, a lower dose. I put the different types of unit of measurements of radiation in the right side of the screen for you to familiarize yourself with it. It could be helpful in practice, especially if you're reading the cardex of your cancer patients. Gray and centigrade are the commonly used ones in the present medical era, but you can also see Curie, Roentgen, Rad, and REM. The other side effects of cancer treatments include erectile dysfunction related to vascular and neurological changes, vaginal tenderness and irritation, loss of vaginal elasticity and lubrication, vaginal shortening related to surgery, and psychological alterations. So the aforementioned side effects of cancer treatments can be managed through, number one, counseling, especially for those patients who are experiencing psychological alterations. Number two, using water-soluble lubricants and or vaginal estrogen to improve vaginal secretion and prevent vaginal dryness or irritation. Number three, vaginal dilators for those patients who are experiencing or who has fibrosis and shortening due to surgery. Number four, pre-treatment harvesting of sperm and ova, especially those patients who are experiencing infertility issues, who just underwent radiation therapy. This procedure involves cryo procedure, wherein the clinics will freeze those eggs and sperm cells, and when the time comes that the patient is ready to become a parent, they will thaw them and make it available for them. Next is external prosthesis for those patients who are experiencing erectile dysfunction, and I also included lists to improve body image here in the bottom of the screen to improve the psyche of our cancer patients. This could involve exercise, maintaining a healthy diet, and eating well, which can also improve fatigue, mood, and self-esteem. Dressing in clothing that makes you feel attractive, wearing pretty undergarments, learning beauty techniques to manage side effects such as facial coloring, eyebrow loss, and etc. What's shown in this slide are fertility preservation resources for cancer patients. These clinics are spread across British Columbia, naming Genesis Fertility Center in Vancouver, Kelowna Regional Fertility Center in Kelowna, Olive Fertility Center in Vancouver again, Pacific Center for Reproductive Medicine in Burnaby, and lastly, Victoria Fertility Center in Victoria. Now, although physicians' referral for consultation and lab tests are covered by MSP, it is vital to bring up and consider the income of the patients, mainly because cryo procedures can be quite expensive. For cancer patients, the storage and freezing of egg cells per year costs $2,500 and $150 for sperm cells. So this is the end of my presentation. These are my references as you can see it. I hope you guys learned a lot. Our remaining time will be allocated for answering the evaluation sheet that I have provided. I hope you guys are staying healthy at home in this time that we are facing a crisis. I hope you learned a lot. That's all, and thank you very much.